Okay, so it's with great pleasure today to introduce Dr. Roman Fishchuk from Ivano-Frankivsk, Ukraine, who is now going to give us a very in-depth lecture on education, healthcare, and his work in the Ukraine. Roman, please, I pass the baton to you, and we're looking forward to hearing from you. Thank you.
Okay. Hi everyone, and hello, Richard. Thank you for the introduction. And today I'll try to give a glimpse of what healthcare in Ukraine is and what Ukraine is in general as a country, and what kind of how ENT specialists work in Ukraine. Again, I'll try to give a quick overview about the things. I know we could all talk about how things work in our countries for hours, so I'll just try to cover the major points, and there will be a lot of pictures in the presentation. So if at any point you have any questions or remarks, just write them or ask me a question, and I hope we'll have some discussion in the end as well. We'll have some questions and answers. Yeah, now I'll turn my video off so to make sure that the internet works correctly and fine, and I'll just start sharing my presentation. Okay. So yeah, I'll talk about ENT services in Ukraine, and I'll cover the following topics. I'll talk about country details, where Ukraine is, what kind of country Ukraine is, because we all come from different parts of the world in this group, and it's natural that if we don't live in a certain area of the world, we don't actually know a lot about this part of the world. So I'll talk about our community, give some background on the population, how many people live here, how many doctors work here. Then I'll tell you a few words about the uh, pathway that every doctor takes in Ukraine. So starting from school, and then about medical school, medical university, internship or residency. Then I'll talk about the places where I practice, and show some pictures of equipment that we have and that there are in different hospitals. Then cover and discuss a few financial issues, how the healthcare system is funded. Do people need to pay for their services? Are they covered by the state, by the government? And I'll just mention a few major challenges that we face here as medical professionals, and then we'll just hopefully have some questions and have a discussion. So this is actually the picture of the mountains that we live nearby. It's just 100 kilometers away from us, and this picture was taken, I think, about 2 or 3 weeks ago. So now it's quite cold in Ukraine. I think right now it's about minus 15 degrees Celsius, which is quite cold, and we're getting some snow showers right now. So a few details about Ukraine as a country. In the next slides, it will be just UA. That's the international short version for Ukraine. So the population is approximately 40 million people right now. Actually, the geographical center of Europe is located in Ukraine, in the western part of Ukraine. And the doors on the left, the blue and the yellow, these are the colors of the Ukrainian flag. And usually it's interpreted that blue is the sky and yellow is the wheat, because Ukraine is a big agricultural country. So blue and yellow, these are the colors of the national flag. So the number of doctors in Ukraine is approximately 190,000 doctors. I think this is quite a big number of doctors. So on one hand, Ukrainians are quite lucky to have such a huge number of medical specialists, but on the other hand, it has its drawbacks as well. And we'll talk about this later. Uh, in terms of ENT doctors, we have around 2,800 ENT doctors in the whole in the country. and this was published by the in an analysis in 2019 by funded by UK Aid USA. So since our group is ENT doctors and who focus mainly in otology, audiology, unfortunately there is no such subspecialty officially in Ukraine as otology. So you can't get a fellowship, for example, for otology. There are courses, short courses that last about 2 months for people who want to learn how to examine hearing, but that's not otology. So unfortunately, we don't have such an opportunity to be trained in just in otology or rhinology. We have ENT specialty in general, and then we can take short courses focusing on specific topics in ENT. And the same, and coming back to otologists, so basically in Ukraine, we have just a few ear surgeons who actually do safe ear surgeries for the patients, and you can count them on one hand. So up to 5 doctors for the whole country, 40 million people, which is a very small number. I mean, and this is all subjective because that's just my point, my view on this, but that comes from years of work, from networking with other people, seeing many patients and getting feedback from them. So up to if I needed to have an ear surgery done, actually there are up to only 5 people who I would go to, and that's, I think, is quite sad. But again, on the other hand, it's a window of opportunity for young generation of medical doctors who want to be trained and provide good services for the people who need them. And small number of otologists and ear surgeons means that there are many patients who are not getting proper surgical care of their ear diseases. Yeah, and moving on to hearing testing. So again, we don't have an audiology as it is, but we have another name which is called surdologist, and I think that's just something like we inherited from the Soviet Union, this name. But I hope that in years we'll just move on to the name of audiologists, and we'll have a specialty like this, and it will be recognized officially in Ukraine. So yeah, these are just basic details about the country and some perspective on the quantity of doctors and ENT doctors in Ukraine. So that's the world map, and this is where Ukraine is. So again, if we talk about geographical Europe, Ukraine is one of the biggest countries in Europe, and the population is quite large as well. So we all come from different parts of the world, and if you look at it, Ukraine is sort of in the middle of it. So that's where we live. So now I'll just show a few pictures from my hometown. This again was taken, I think, in sometime in spring or summer. Actually, when Richard came to our town, he stayed at the hotel right here, and this is just city center and an old synagogue. Before World War II, there were up to 50 synagogues in Ivano-Frankivsk, in our hometown, but now there is only one, unfortunately. Yeah, and I heard that they want some project that they will renovate it and refurbish the whole building, so it should become much better and look much nicer. Again, just we have parks. We don't have Ukraine is a big country, so we have mountains, we have flat terrain, we have forests, but we don't have deserts. But we have a two seas, and a lot of rivers, lakes, and in most places we do have quite a few parks, so you can walk around during summer or winter. And the architecture is it's quite old, because part of Ukraine was under the rule of Austria, Hungary, Poland. So the architecture looks quite a lot like you can find in Poland, for example. And some buildings are from 1900s, early 1900s. Those that are still there. Uh, Again, some nice views. This is a city not far from us called Lviv. It's a bigger city and much older. And this is a panorama view from one of the rooftops from the in the city. So let's go back to our community. So the name of the town is Ivano-Frankivsk, as Richard said. The population of the region where we live, because Ukraine is divided into regions, is 1.5 million people, and the population of the city itself is 250,000 people. So this is actually a picture taken from the top of the city hall in Ivano-Frankivsk. It's not a big city. It's quite compact, and it's easy to get around. You can actually basically walk from one place to another. It's much quicker than taking a car these days. So the number of hospitals in the region is approximately 27 hospitals, and we have about 15 different hospitals in this city. So this is not just general hospitals. This is also in hospital for patients with infectious diseases, maternity hospitals, hospitals for people who have tuberculosis. So all the or psychiatric diseases. So just general number of inpatient hospitals. And the number of ENT doctors in the region, it's about 85 people, and about 50 of them work in the city. So we have ENT doctors working in the hospitals. We have ENT doctors working in outpatient departments or polyclinics. So that these are institutions where you don't actually stay overnight. You just go and see a doctor and get a consultation from a doctor. So how to become a doctor in Ukraine? So the school, like primary, secondary, high school, it's not really divided like that in Ukraine. It's just basically school, and it lasts 11, 12 years. It's, they change it every now and then because another educational reform comes, but basically it's 11, 12 years. Then after school, in the last year of your school, you take tests, and then you need to get certain number of points, and then when you are admitted to the medical university, when you apply for medical education, you need to have a minimum number of points when you submit your documents. So if you have less than 150 points, you can't actually you can't apply to study at a medical university. So I think the minimum number of points is 150, and the maximum is 200. So in the specialties that you need to apply with. So there is no specific test, basically. So you just need to submit your results from school, and if you pass, then you can either study. If you are in the top of the applicants, then you can be considered for that your study you will be paid by the government, and if you don't make that short list, then you need to pay for your education yourself. The medical university, you study 6 years at the medical school. There is no separate college for it, like in the US, for example, that you go to the medical college and then you go to a medical school. It's just medical university for 6 years. And upon graduating from the medical university, you receive your MD diploma, but you can't practice yet. So you have the diploma, but you need to specialize in a specific specialty. So which is called internship in Ukraine. And the internship lasts from 1.5 to 3 years, depending on the specialty that you choose. So for ENT, it's 2 years. For example, for obstetrics, gynecology, and general surgery, it's 3 years. For psychiatry, I think it's 1.5 years. For dermatology, it's also 1.5 years. So depending on the specialty you choose, it will, the duration of your internship will differ. And actually, when you finish your internship, you take an exam at the end of the internship, and once you're done with your internship, you're actually ready to go ENT doctor. I mean, officially, you can see patients, you can do some you can do some surgeries, but you must understand that you can't become a good ENT doctor in just 2 years. It takes much more time and much more practice to be good in anything. So I my personal view is that the internship is too short in Ukraine, because you actually finish your residency internship and you get all of this responsibility for your patients, but actually the system did not prepare you well to take all this responsibility. And that's something that is being discussed at the level of the ministry, that they want to change the duration of the internship. So interns can have more time and more time to get more skills and become more confident in themselves.
Roman, just a couple questions. In your in your medical university for those 6 years, is it strictly science study, or do you have like 4 years of science and 2 years of clinical work where you go to the hospital, see patients with, with interns and staff members? Can you break down those 6 years for us a little?
Well, the first 2 years, it's basically anatomy, physiology, histology, pathological physiology, and then some basic classes, like we have foreign language, we have history, we have culture, we have physics and stuff like that.
Okay.
Starting our third year, then we start having clinical classes. So actually get to see the patients, and we go to the hospitals for classes. And we have different levels of, for example, pediatrics. In the third year, you have basically you study about how to care about pediatric patient with certain diseases. Then fourth, fifth year, you start having pediatrics in terms of more of a disease oriented pediatrics. Then you start learning the disease symptoms, how the pathophysiology, treatment. So that's what fourth, fifth years are focused on. And your sixth year is divided into cycles. So you, for example, you have a month of gynecology, or 2 weeks of ENT or ophthalmology, or 1 month and a half of internal medicine. And then and every day you go to the hospital and see at the Department of Internal Medicine and see patients with internal diseases. And that's only happens in your sixth year, like that, because before that you just have different classes every day.
Okay, I get it. Then one other question: if you score between 150 and 200, and the government pays for your education, that's great. But let's say you have to pay for your education. What does it cost per year for somebody who pays for their medical education, and they're Ukrainian?
Yeah, for Ukrainian citizens, for Ukrainians, if I'm correct, I think it's about $1,500 per year, something like that.
So $1,500 per year, and
Yeah, for foreign students, I think it's either $3,000 or $4,000 per year.
okay, and do you have many foreign medical students coming to Ukraine?
Uh, if we don't consider this year because of the COVID pandemics, then yes, we do have quite a lot of foreign students in Ukraine in general. So only our university has about 1,000 foreign students, I think, something like that.
Okay, and then the other question is, have you? It's obvious with the COVID that has the enrollment decreased significantly for education.
Yeah, it's been extremely difficult for foreign students actually to get here. I mean, they've applied for this to get into the medical university. They were admitted, but it was actually difficult for them to physically get here.
Okay, great. Thank you for your comments.
Yeah, but yeah, the admission decreased everywhere, and now it's with all this mixed learning. It's quite difficult, and the way they do it right now. So the 6th year of medical students is going to basic departments like anatomy and physiology and has their classes there without any exposure to the patients. Whereas patients, not patients, but students in their first, second years, they are all at home and doing, and learn and have distant learning, which in my view is sort of something. It has to be vice versa because, that's where that's where you learn anatomy, when you see the bones, when you touch them, when you look for everything that you see in the book. Because if you don't get to see that, you won't know where it is, and it will be much more difficult when you go into practice and you go and see, like, even surgery, and then it's difficult to see to know your landmarks when you observe a surgery. But anyway, that's just the way it is right now.
And here's my last comment. Internship in Ukraine is essentially the residency in the United States. And
Yeah, yeah,
for ENT, it's 2 years in Ukraine. In the United States, it's 5 years. So,
yeah.
we're kind of going from one extreme to another, but I just want to bring that just so the people are aware of what's going on. Okay, thank you much. Continue on with your lecture.
Yeah, so yeah, so that's how you become a doctor. And that's why every time Ukrainian doctors who just finished their internship go to some sort of a medical conference, and they are what, 25, 26 years old, and they say, okay, I am a medical doctor already, and I practice ENT or ophthalmology or any other specialty. People look at us and say, wow, you're so young. And that's just because the duration of the education it differs from the duration in many other countries. But yeah, that's the way it is right now. But it might change in the next few years. So, but we'll see. So this is about, yeah. Now I'll talk about places where I practice. So it's a hearing center and the city hospital. Uh, so the hearing center was founded in 2014 as part of the medical university, and since that time it has evolved into a private practice, uh, which is quite open to young medical professionals who want to work, who want to improve themselves, who want to help other people. And one of the examples is that this guy Bogdan, he's a medical student right now, but he wanted to sort of not volunteer. He got paid for it. He had some sort of like a summer job at the hearing center a few years ago, and he worked as a receptionist. So that was something that he wanted to do. And then because he was exploring different parts of medicine, he did something. He worked at the gynecology department. Then he worked a few months for us. So he was just exploring how different specialties work, what kind of patients you see, and then and so he wants to make the best decision for himself, to find himself where he wants to work in which specialty. So, but this is just an example of the fact that we are open to different people who are interested in the specialty. We're open to sharing the knowledge and the skills that we have, and are always welcome people who would like to come and bring something to our practice as well. Uh, so this is just a picture of what the place looked like a few years ago, right? This house and what it looks right now. So we occupy well, depending from where you come from. If this is the ground floor, this is the first floor. If you say this is first floor, then this is the second floor. So the hearing center is all the way here. It's about 110 square meters. We have 3 rooms where we work with patients, and I'll show you a few pictures from those rooms with equipment and what we can do at the hearing center. But again, in just such a short time, this was the building, and then it was demolished by the construction company, and then they built this new one. And it's located just opposite to the hospital, which in our case is quite helpful, because if patients from the hospital need to get their hearing tested, then they can be referred to us for the diagnostics. Uh, this is not the best picture, but This is the hearing center, the first room that the hearing center had at the university, which was back in 2014 and 2015. So this is the microscope that Richard helped us get from Italy, from one of the geo directors, from Giovanni from Bergamo, and we brought the microscope from Italy to Ukraine, and that's where it was located first, here in this room. And here you can see the audiometry booth with equipment, so we could test patients over here. And yeah, we look happy here, and that was great because we don't have many microscopes in Ukraine for as ENT doctors. So this was a big achievement for us, because we were just starting the program to help people with the ear diseases. So to get the microscope was really a big step forward for us. Yep. So this is the hospital where I work. These pictures were taken yesterday. So you see this is an outpatient department over here, and where ambulances come, and then patients are screened and then diagnosed, and it's decided where the patient should go to which department. So this is the sort of a clean emergency department here right now. And we have another emergency department over here where patients with COVID or who have a suspicion of COVID come, and they are admitted in a separate place. Yep. So this is what an examination room looks like at this hospital for an ENT doctor. So that's where the patient sits, that's where the doctor sits, and you see it's quite basic, because many doctors still use a lamp and a reflector on their head to examine ear, nose, and throat, and larynx as well. So again, not much, to be honest. But again, these are the conditions we work in. But again, whoever has an opportunity and the means buys otoscopes, endoscopes, and uses them in their practice. But again, they have their own. It's not that it's supplied by the hospital for general examination. This is the view from one of our rooms at the hospital. And again, this is the same hospital. And you see what it looks like. There are some really bad places at the hospital. This happened about 2-3 months ago. We had major showers for a few days, and it just the ceiling just leaked, and the whole floor was covered with water. So again, some parts of the hospital are really nice and in good condition, but some parts of it are just in bad condition, like this one. So I think this is quite universal for countries, for developing countries. There is such a huge difference between rich people and poor people, and the same with healthcare institutions. In some places you have very nice, very modern, with very sophisticated equipment medical centers, and on the other hand you have see hospitals where you have things like this. Besides working at doing seeing patients at the hospital or the hearing center, we also practiced outreach clinics. So we would contact doctors in remote areas of our region, and they would make a list of a few patients they wanted to be checked, and patients who couldn't actually come to us and be examined. So then in that case, we would take our equipment with us and go to these remote areas, and then consult patients and diagnose them, and do hearing testing for them. So we had usually when we do these outreach clinics, we have a digital otoscope, so we can take pictures of the eardrums. Then we have an audiometer, and we have a tympanometer with us, so we can actually and tune-in forks as well. So this helps us makes the diagnosis and decide what further actions are needed in order to help this patient, to refer him or her for hearing aid fitting, or refer for surgery or anything, or refer to another specialist. So this is something that we also used to do, outreach clinics. Of course, in current conditions, it's not feasible to do this, but again, hopefully, once when everything goes back to, sort of normal situation, then we'll be able to do these outreach clinics as well. Equipment. So again, this is equipment that we use at the hearing center. Again, you can see the audiometry booth, and then we have this device which has both audiometry. We can do audiometry, the pure tone audiometry with it, speech audiometry. Then we can do tympanometry and acoustic reflexes with it. And when we do tympanometry, we actually do it via a laptop, so we can actually print out the results and give them to the patients, because PTA we just draw the result on the chart. And we have the booth. We tried to soundproof the room where we do this, but again, because of the window which is facing a road, sometimes you can actually hear some noise, but it doesn't interfere with the examinations, with the testing usually. And the basic set of things we do during audiometry, it's air conduction, bone conduction, uncomfortable loudness levels, and masking, of course, when needed. We have again in this audiology room, we have this set of equipment that we can do free field audiometry and visually reinforced audiometry for children, and play audiometry as well for children. And this is examination room. We have a wireless endoscope and a digital otoscope, and flexible pharyngolaryngoscope, so we can so we're set to make the full diagnosis of a patient and examine all of the ENT organs, and actually help the patient define what's bothering him or her. So we also do ABR, ASSR. We have an interacoustics Eclipse device. So we have a laptop and the device itself, and this is how it's set up. So this is one of our patients. So we don't use sedation for this testing. So we try to prepare the patients for this test and explain them, and take some time to explain under which conditions the test can be performed successfully. So we do try to have the children come quite, well, not exhausted, but tired. Then I prep the skin, fix the electrodes, and then the kid falls asleep, and then I put the inserts into the ear canals and fix the electrodes, and then start the testing. So that's so we at the hearing center we can do audiological testing for basically all age groups, starting from newborns all the way to adults. So ABR, ASSR, autoacoustic emission, pure tone audiometry, play audiometry, visually reinforced audiometry, free field audiometry, tympanometry, acoustic reflexes. And the good thing about this that it can be done under one roof, so you don't have to go to different places to have it done. It can be done on the same day. So this is about diagnostics, and actually this toy, this monkey, we work with another fund we work with is Hear the World Foundation, and they help families who can't afford to buy hearing aids for their children. They provide them for free, and there was volunteers from the Hear the World Foundation came to us a few years ago, and this is just some of the toys we give out to children who also receive hearing aids, and just to make them calm if they are stressed or something like that. And with this foundation, worked for like two years now, and with the global ENT outreach, we've started our the initial contact was in the end of 2011, and the first visit was by Richard to Ivano-Frankivsk was in March 2012. Yeah. So I think and when we look back, we've evolved a lot and improved a lot. So now from basically not knowing anything back in 2011, now we can provide uh, I would say good services to many people, to many patients. So this is diagnostics. This now it comes a few pictures from the Geo mission. This is an old operating theater that we had at our hospital. Now it's not there anymore. But again, at that time we didn't have a microscope yet of our own, so we rented a technoscope, a small microscope that we mounted on a table. But again, it was optically, it was completely enough to perform surgeries. So you see the setup of the how the OR is set up, the microscope, instruments, surgeon, and then cautery over here, drill, and the anesthesiologists as well were present. Yeah, look at this anesthesia device. I'll show it in a separate picture, which is really old. So this is an old OR. We actually had a monitor where we projected the image from the operating field, and you can see here there are medical students. For medical students, it was easier for them because probably everything was in English in the OR at that time, so it was easy for them to understand what was happening. So that's good. And that this was probably 2013 or 14 actually. And these are another few pictures of the devices we use in our daily practice. The microscope, which is which is located at the hospital. A very similar one is at the hearing center, which was also donated by the global ENT outreach. This is an endoscope we use both for surgeries and for just diagnostics and the regular examination. This is something that is located at the hospital. This is a multifunctional unit, but right now it just serves in the hospital as a source light, to be honest, and suction device. And here you can see a chair. Unfortunately, again, now most of the tonsillectomies are performed under local anesthesia, and patients sit during these procedures. So most of the doctors who do them, they do these procedures under local, which is not very pleasant for the patient, of course. And this is the new OR. You see it's much brighter and better equipped, better table. Again, now this is the microscope that is there permanently. I mean, that is used during the surgeries. Old anesthesia device. Again, the Ostap is here, our colleague. And Richard. So that's and this is a cautery device over here underneath. So yeah, this was a basic setup for the when Richard came to perform the missions. Again, this is the machine, this anesthesia device, which is very old. You actually have to do it manually over here. You have to pull it up and down and push it down. This is an exam room at another hospital. So you see, that's still the case how ENT doctors examine patients. They use a lamp and a reflector on the head. These pictures are from the children's hospital. Again, examination room with instruments, lamps, chairs, and this is the entrance to the OR. They have instruments set over here and which are used during the cases. So you see not the best conditions, but again, something, but you can work there. And the most important is to help your patients. And if you manage to do it in the conditions that you have, it's great. If you are able to improve these conditions, that's even better. So any questions about this? Because I'll move on to another part right now. If no questions, then just a few words about general financing of the healthcare system. So it's healthcare in Ukraine is considered free, meaning that patients are not supposed to pay for their services at the state institutions. But you understand that nothing is free in the world, and someone has to pay for it. So we don't have special taxes for health, but and money is taken from general taxation to fund the public hospitals. And obviously, as in every country, probably this money is not enough. So many private hospitals are emerging right now. I think in the last few years, we've seen an increase of private practices, not only big private hospitals, but also small private practices of individual doctors. And with this, patients have a choice whether to go to the public hospital or go to a to a private clinic and be diagnosed over there. Usually, average appointment fee starts from $10 and up. So, for example, at the hearing center, general ENT consultation is about $12, $14. In at some places it goes up to 20, 25, $30 per consultation in national currency, but just for the sake of it, I'm just transferring it into US dollars as an international currency. uh, so yeah, there aren't many private hospitals where you can actually be operated with an ENT condition, but there are some. So even if you want a surgery done, you can select whether go into a public institution or go into a private hospital. Mm, at our hospital, we also have two CT scanners, one that is used for emergencies and the other one which is used for more sophisticated examinations. We don't have an MRI device at our hospital, but there are a few available in the city. So that's again accessible as well. Uh, Healthcare is run by the ministry, is administered by the Ministry of Health. So basically, I would say it is administered and controlled by the government. But again, now more and more private practices start functioning in the country. Insurance, there is no universal insurance for everyone or mandatory insurance, but insurance companies offer medical insurance, and those people who work for big companies, they can be insured like that, or whoever wants to do this voluntarily can go to any insurance company and choose a plan of insurance they want to have for their health. So that's just basic things about how healthcare is run in Ukraine. Challenges. So challenges that we face in Ukraine in terms of health, medicine, and ENT, education and training. We do have a lot of doctors. We do have a lot of medical students. So for in the country we have 16 medical universities. So you can just imagine uh, how many graduates we get every year. At some point of time, we had 15 ENT interns just in Ivano-Frankivsk. And imagine that there are bigger cities with bigger universities and bigger numbers of ENT interns in other places. So we do have a lot of doctors and a lot of interns and medical students, which I would say is not, on one hand, again, it is good because patients have access to doctors, but on the other hand, the quality of training and education suffers from this a lot. And because physically you can't teach that many doctors to be very good in all of the ENT or in a certain specific specialty. And to be honest, you don't need to have that many specialists in this area. So once you have many doctors, then you always have this, that this doctor is someone's relative or someone's son or daughter. And then again, this leads to things like some interns or students or doctors are more privileged than the others. It's not it doesn't happen everywhere, but sometimes this happens in Ivano-Frankivsk, for example. I had this I had to face this thing because I don't have any relatives in medicine, so I had to do to find my way through the medical education and ENT education somehow. But again, at the hospital where I did my training, there were five families of a father or a mother with a son or a daughter, and trust me, they would not be training someone else if they have a son or a daughter with them in training. So this makes things quite complicated in terms of training. Um, History of isolation. By this I mean that Ukraine, as a former part of Soviet Union, is still considered to be a closed country and unknown country. But I I hope this is changing and this will change. So not many. Uh, so we don't have as many humanitarian missions or people from other countries coming to Ukraine and sharing their knowledge or experience or assisting here improve healthcare. Fortunately, there are people like like Richard, like Global ENT Outreach, like some other charity foundations who do understand the importance of this and help a lot improve our skills and help with equipment, help with knowledge, help with many things. But again, because of this isolation that we had, it's quite difficult to become a, to become visible, not visible, but become and have partnerships and real partnerships with the medical doctors from other countries and be involved in the international community as medical doctors from, for example, from I don't know, from Germany or France. uh, Quantity of specialists I already mentioned. Bad competition, again, by this I mean that in sometimes doctors do not compete by their results, but start bad mouthing about other people. So this is something that I think is very, it must be absent in medical practice. So whoever saw the patient before you, you don't need to say anything about this. You just need to provide the best care you can to this patient at this specific point of time. Mm,
Roland, I'd like to make a few more comments. Per capita, Ukraine has more ENT doctors than the United States. But
mm,
you have mentioned this, and one of my most discouraging, one of the things that discourages me more than anything is that, and you alluded to this as well, your internship needs to change. Your internship needs to be 4 years, if not 5 years in ENT. And the basic science and the laboratory work probably is okay, but the ability to get hands-on training in surgery is where I see the biggest failure. And I say that because by the time you do 2 years of ENT, you can most likely do septoplasty and tonsillectomy. But when we get into the other fields of like advanced laryngology and otology and head and neck surgery, um, these are subspecialists within a specialty. And not only do we have to go for 5 years of ENT, but we have doctors that are neurotologists or otologists spend another 2 years. So that takes what you consider to be your internship from 2 years to 7.
mhm.
So it's really mandatory that either within Ukraine itself, the opportunity for improvement in the educational process by extending the years and developing programs that focus on specific areas like otology. Otherwise, members of the Ukrainian ENT community who want to become, you know, proficient will have to either do one of two things. They'll have to be related to a family member. And we have Artem who's joined us today. And Artem's fortunate that his father's an ENT who knows how to do ear surgery. And Artem has the opportunity to learn the needed skills from somebody who's competent. If you don't have that opportunity, such as he does, you're going to have to go overseas. You're going to have to go find a program where either you might have to start your medical education over because depending upon whether or not the medical education is certified according to European or another country's standard is the first question. And then you're going to have to learn the art of surgery. For me, one of the most challenging things is to come there and try to teach somebody ear surgery when the skills that they have are so limited because of the educational process in Ukraine. And I think that's a really important area to focus on. Okay.
Mhm.
So I just wanted to
Yeah.
make that comment.
Yeah, absolutely, Richard. And you've been here quite a few times now, and you know how things operate here. And I think this is quite universal for many for some countries as well. And again, this is something that needs to be worked on and improved. Yeah.
Exactly. Exactly.
Well, I'll show a few more pictures. So this is a picture from the Children's Hospital. So we had a resident from the US come to Ivano to observe the missions. Then this is John from London, and an anesthetist, and his daughter who came here, and he's been to Ukraine a couple of times now, and he's doing some educational work in Ukraine as well. Richard, who you all know, this is Ostap, a colleague of mine, who is also listening to the lecture, who is a member of the group, and Miroslava, a colleague of ours, who focused on audiology as well. So this was at the Children's Hospital between the cases, I assume, and these are the kids that were operated during one mission. And usually we would have a few days at the Children's Hospital and a few days at the adult hospital. And I think what Richard always said, that this is the most rewarding to help the kids who, sort of in childhood, you sort of save their lives because they could actually die from the complications of the ear diseases. And this brings me to I would like to say a few words about hearing aids and cochlear implants. So we do have a national program for hearing aids and cochlear implants for children. Uh, but again, the hearing aids that are provided to the children, we stick to the idea that the best hearing aids for kids are made by Oticon or Phonak, and the hearing aids the children get by is funded by the state or of other manufacturers, which is just it depends on who won the tender and who offered the best offer, who offered the best price. But you know that in developing countries there is a lot of not only politics and bureaucracy but some corruption to it as well, unfortunately. So in terms of cochlear implants, we do have a cochlear implant project, a program for kids as well, which is funded by the government. There used to be a big line for cochlear implants. Now it's decreasing, and now, as far as I know, they have a digital line for children. But again, unfortunately, again, as I heard, that it can be meddled with. So if you were, the last in the line, you could, with due to some things, you can actually go up the line and be operated quicker than some other people. But again, it's good that this program is funded. It's good that children are being operated and implanted and start the hearing the sounds around them. They actually started a cochlear implant program for adults last year. So as far as I know, they've implanted a few people, and they do have some funds for this program as well this year too. So they are starting helping adults with the hearing loss as well. And this is one of the educational events we did. So this is for the cochlear implant day, which is I think in sometime in May 20th every year. So we brought a few families whose children were already implanted and whose children were about to be implanted, to just to talk to each other, to share their experiences, their fears, their emotions, and some tips. And this was just something, an example of things we try to do as well. Uh, so yeah, this was just, I know I touched upon different things, some more superficially, some more deeper. Uh, it's difficult to tell everything about a country or health system or a certain specialty in just in this short of time. But I hope you just got a glimpse of what's it like to work and be and work as a doctor and be a patient in Ukraine, and what options are there for you. And yeah, if there are any questions, I would be more than happy to answer. And yeah, thank you for your attention. And the story is all, yeah, just over in just an hour. So I hope you weren't too bored listening to me and looking at these pictures.
Thank you, Roman, very much. We're going to put this on the YouTube channel for Global ENT. Oscar, since you're here and you're a colleague of Roman's, do you have anything you would like to add to the lecture today? Any comments about your own experience in Ukraine? And Artem, if you're still there with us as well, since you're a Ukrainian ENT, if either one of you have any comments, please feel free to share those with us now.
Thank you, Roman, for such a nice presentation. Uh, Actually, Roman covered all the main challenges and all the main features of Ukrainian medicine and the ENT specialty as well. Uh, the biggest challenge is that the training is very short in Ukraine, and we have a lot of specialists in this area and generally in the whole Ukraine, but the level of expertise is not at the very at the sufficient level, especially about some subspecialties that are usually present, and you could get a official training, formal training in those subspecialties. Not only otology, but as well as head and neck and laryngology and other subspecialties. And another issue is, it's in my opinion, is lack of collaboration between different specialists, especially in ENT. There's definitely lack of collaborations between dentists and ENT specialists and the ophthalmologists and some neurosurgeons and neurologists. Like the neurosurgeons, they prefer to operate on their own, even when they go endonasally to remove the tumor from the anterior skull base. And the dentists, they cannot find a connection with ENT specialists when they are having some trouble after the sinus lift procedures or dental implantation. And that's another problem that I think Ukrainian doctors, they should learn from the colleagues abroad. I know that's it. A very good presentation, a lot of pictures, and some of them are quite old. Even for me, it's maybe 5 or 7 years, and it was nice to see them again.
Well, thank you very much for your comments. If anybody else has any comments, please share them. You know, we're going to have lectures from Poland, Ethiopia, Paraguay, India in the next 2 months as well. So if anybody would like to share their country as well, please let me know, send an email, and I'll put you on the calendar. But I think this is important because, you know, we're all in a global forum now. We need to understand, you know, the basics of diagnostics is pretty universal. You know, the books of ENT assessment go back to the 1900s. I mean, we have, you know, Pulitzer, and, you know, we know how to do these, you know, otoscopy with a regular otoscope. We know how to use a nasal speculum. We know how to see disease. But with the passage of time, we've developed newer technologies, MRI, CT scan, PET scans, which allow us to visualize the body even at a deeper level, improve upon our understanding of the extent of disease, and helping us with the diagnostics. So, it's Ukraine. I've been a patient in Ukraine. I've had a CT of my temporal bone there. It was on par with the quality that I received in the United States. The MRI, the CT scanner is state of the art. Okay. But again, some of the more highly sophisticated equipment that you need for advanced surgeries, you're only going to get it in the capital, like in Kiev. It's very expensive. The healthcare system is short of money, as is every healthcare system. But as we go through this series, let's learn about each country. Let's find out, the good points and the bad points. And I think Roman very well covered the introductory lecture on this subject. And I want to thank him for spending his time and for everybody for joining. And we'll look forward to next week's lecture. And I'll share with you my recent cochlear implant that I got in my right ear and the story of how it happened and where I am at about 1 month. Okay. And I'll look forward to seeing you all next week. Roman, thank you. Any other comments? If there are any, I'll end the session and wish everybody a nice week.
Can I just show a short video clip from the national news when you were here? Just a quick one. Hold on.
Sure, go ahead.
I'll just share the whole screen. Yeah, so this was in 2015, actually.
Коли дівчина дізналася, що американський отохірург
So this is the OR, the setup, the anesthetist, and the girl who was operated, she couldn't go to another place because of the distance and everything, but she could, and she was really happy she could be operated in Ivano.
Наймолодшому з його пацієнтів лише 5 років, найстаршій – 71. Хвороби різні, від хронічних запальних процесів до косметичного дефекту вушних раковин.
Зі своїми пацієнтами я познайомив.
Yeah, so nice throwback to the
to the early days.
yeah. Yeah, thank you very much. Thank you for this opportunity, and it's great to see what this group has evolved to since the beginning. It was just a few people, talking on different interesting topics, and now just a whole international educational group and program. It's great.
Very good. Thank you, Roman. Thank you, everybody. We'll see you next week.
Thanks.